Hi everyone and welcome to Family Connect. I think you all know who I am. My name's Lauren, and I work with Enable. Tonight I am joined by Iona from Joe's Cervical Trust and Heather Gilchrist, one of our staff members. Um, Unfortunately, we've had some technical difficulties this evening, so we've lost connection with some of the people that we're trying to attend the session. Um, we seem to have not been able to get them back, so it's just us tonight. But I know that lots of you had emailed me asking specifically if we were going to record the session, so I didn't want you to miss out. So Iona had prepared some interactive bits that maybe now won't be as interactive, but we're just wanting to make sure that you get something out of this session. So bear with us. But Iona, Heather, thank you so much for joining me. It's lovely to see you both. Iona, I will hand over to you. I know that you've got a wee presentation there, so I'll hand over to you.
Yeah, thanks, Lauren. I'm just about to share my screen, so just bear with me a second
No probs.
while I do this. And yeah, that should be it now. So good evening, everyone. Like Lauren said, we have had some technical difficulties, so I was hoping to have a bit of a conversation tonight, but I will just be talking a lot myself. And luckily, I've got Heather here as well, who is going to kindly share her experience with you tonight as well. But it's a little bit different, so please bear with me if it just seems like I'm doing an awful lot of talking. So my name is Iona, and I work for Joe's Cervical Cancer Trust, and we are the UK's leading cervical cancer charity. And we've been working very closely with Enable now for it must be coming on 4 years. So we've got a really good relationship. We've worked a lot with the members and the staff on various projects. So I'm really pleased tonight to be here talking to carers and people who work with the members of Enable. So tonight I'm here to talk to you about cervical screening, as the screen suggests. Um, so who are Joe's Cervical Cancer Trust? So you may or may not have heard of us. We are quite a small charity, but I guess that's because what we do is quite niche. We support people with cervical cancer, and we provide information for anyone with any questions around how to prevent cervical cancer or cervical screening and HPV. So like I said, we're the leading charity in the UK. We were founded in the year 2000 by a man called James Maxwell, and he created the charity in memory of his wife, who was called Joe. So hence that's why we're called Joe Cervical Cancer Trust. And Joe was diagnosed with cervical cancer. She was in her early 40s. She had not long given birth to her youngest child. She had 3 children, so you can see some pictures of the family there. And not long after her third child was born, she was diagnosed with cervical cancer and she sadly died. And when Joe was diagnosed, it would have been in the 90s. There wasn't a lot of information available to her, so she found it quite a lonely experience having cervical cancer because she wasn't able to find a lot of information about the disease, and she also wasn't able to connect with other people who were going through a similar thing. So after she died, her husband set up Joe's Cervical Cancer Trust in her memory to try and address those issues. So our vision as an organisation is for a future where cervical cancer is a thing of the past. So we believe that cervical cancer can be eliminated within our lifetime, and not the too distant future. So that is quite an exciting thing that motivates us to do everything that we do. So some of the work that we do, we provide information and support to healthcare professionals, to women generally across the UK. We run campaigns to add around cervical screening and HPV vaccination, and we raise awareness and try and educate people. So everything we do is around these kind of topics. So tonight, what I want to cover is 3 main things, really. So I'm going to talk about what cervical cancer is, how to prevent cervical cancer, because like I said, it is the type of cancer that we hope to eliminate. So it is preventable in a lot of occasions, which is not the case with many cancers. And I want to talk about cervical screening and women with a learning disability, because like I said, we've done quite a lot of work now with Enable, and it's something we feel really strongly about. So to begin with then, what is cervical cancer? So cervical cancer is, like the name suggests, it's cancer that specifically happens in one part of your body. So that is the cervix. And you can see in the pictures here, the cervix is the opening of the womb from the vagina. So your cervix has got 3 pretty important jobs in your body. So when you're pregnant, the cervix, because of its location just at the bottom of the womb there, it kind of closes really tightly and it keeps the baby in, basically. During childbirth, it then opens to allow the baby to be born, and every month it kind of regulates blood flow during your period. So it's quite an important part of the female reproductive system. It's a very small part of your body, but it has quite a few important jobs. So cervical cancer involves that one specific part of your body. So anyone with a cervix can get cervical cancer. So some of the stats then. So 9 women are diagnosed with cervical cancer every day in the UK. So that's about 3,000 women being diagnosed every year. And more than 2 women lose their lives every day to cervical cancer. It's the 3rd most common cancer in younger women, so women aged 25 to 49, and that's after breast and skin cancer. So this would have been a quick quiz. So Lauren, I don't know if you're there, I might ask you these questions if you want to kind of have a guess, not to put you on the spot or anything, but do you know what causes cervical cancer? So is it having sex, the human papillomavirus? Is it hereditary, hormonal changes, or having another type of cancer?
Do you know, I'm actually quite ashamed to say that I don't actually know. So this is really interesting for me. But
yeah, you wouldn't be the only one because we don't talk about it very often.
No, but would it be all of them?
Now, that's an interesting answer, and I can understand why you would say that. But there is one clear winner here.
Okay.
And it is B. So it's the human papillomavirus. So human papillomavirus, it's a type of virus, and it's responsible for almost 100% of all cervical cancer cases. But yeah, don't feel ashamed, because I wouldn't have known that probably before I came to work for Joe's Cervical Cancer Trust. It's not something that's particularly well known or discussed. But now when you go for your cervical screening, you will be told whether or not you have this virus.
Yes,
so that's a fairly new thing. You never used to find out.
So I noticed that on my most recent letter, but I'd never seen that before. So that makes
really? Yes.
That makes sense. Yeah.
Yes, so that's why. So I'll explain a bit more about it. So yeah, HPV is really important. So I've got a video here, and this is a video that we co-produced. So we made in partnership with Enable and Enable members. And this is to help explain to anybody. So these videos are available on our website, what HPV is. So please let me know if you can't hear it.
Yeah. Oh, okay.
Yeah, okay.
HPV is also known as a human papillomavirus. It's a very common virus that lots of people have. HPV is different to HIV. HPV usually does not cause any harm, but sometimes HPV can cause cervical cancer in women. Both men and women can have HPV. Boys and girls are offered an HPV vaccine in secondary school. This vaccine can help stop some types of cancer from happening. HPV doesn't have any symptoms, so people don't know they have the virus. HPV is usually passed from one person to another by having sex, touching each other in the genital area, underneath your pants, sharing sex toys. In most cases, HPV goes away by itself after a while, but in some cases, HPV can stay in your body and cause the cells in your cervix to turn bad. The bad cells can lead to cervical cancer. When you go for cervical screening or a smear test, they will check for HPV in your body. Having HPV in your body means you'll be checked more often to make sure you're healthy. Lots of healthy people have HPV. If you have HPV, it doesn't mean you will get cancer. If you're worried about HPV, you can speak to your nurse or doctor or visit these websites. Joe's Trust, NHS.
So, like the video explained there, here's a few facts about HPV. People usually get HPV through skin-to-skin contact in the genital area, so it's quite specific skin-to-skin contact, and that can happen through any of these things. So vaginal and anal sex, any touching in the genital area at all, so that's including hands, shared use of sex toys, and oral sex. So it doesn't need to be penetrative sex for HPV to be passed from person to person, and it can be passed on even if you use a condom. So even if you are using protection, that doesn't give you full protection against HPV. So it's really, really difficult to prevent HPV being passed from one person to the other. It's a really, really common virus. Kind of think of it almost like the cold, really, because it's nothing to be ashamed of, and most people will get HPV at some point in their lives. It can stay inactive or dormant in the body for years, and it doesn't have any symptoms at all. So you wouldn't necessarily know that you have it. So it doesn't cause any problems, and most people will normally clear the virus, their immune system, so like you would a cold. So if you get the cold, you feel a bit rubbish for a few days, but then your immune system works and you get over it, you feel better, so kind of no serious harm is done. HPV is similar in that your immune system normally will just clear it by itself in the majority of people, so 9 out of 10 people will clear HPV by themselves. But that can take a different period of time for different people. And there's no symptoms, so you wouldn't feel any different, you wouldn't look any different. There's absolutely no warning signs to look out for. There's no way to prevent it, and there's no way to treat it. So it is a bit of an unusual virus in that way. Yet, like I said before, it is the virus that's responsible for almost all types of cervical cancer. So how does HPV cause cervical cancer then? So there are around 200 different types of HPV, and some of them are classed as high-risk HPV. So if you get a high-risk HPV infection and your body doesn't clear it over the course of, say, 2 years, then over time, that persistent infection can start to cause cervical cell changes. So you can see in the middle here, the blue cells are looking a bit different. So the pink ones are supposed to show you what your healthy cells will look like. So they're all quite similar in shape and size, but the blue ones are the ones that are starting to change. Over even more time, if those cervical cell changes aren't treated, then if that's left, it can then develop into cervical cancer. So this whole process from being infected with high-risk HPV to developing cervical cancer is really, really slow. It can take anything up to about 20 years. We kind of think really between 10 and 20 years, but it's a really slow process. So that's why the cervical prevention programme that we have in Scotland is really effective, and I'll explain what that is in just a second. So cervical screening identifies those at a higher risk of cervical cancer because it's this middle stage where we can identify people. And even before that now, because like we were saying before, anybody now who goes for their cervical screening will be told if they have HPV or not. So it's a really early stage of this process that we can identify people if they're at risk of developing cervical cancer. So a true or false. So Lauren and Heather, you're my guinea pigs again. Please feel free to shout out if you think these statements are true or false. So and these are all statements that we have had from people who either phone our helpline or get in touch with us. So these are kind of common things that people say. So please let me know if you think they're true or false. So I haven't had sex for many years now, and my last smear test was clear, so I don't need to go again.
I think that's
False.
false. Yeah, false.
False? Yep, you're both right. So even if your last smear test or cervical screening test was clear, so if that showed that you didn't have HPV and you haven't had sex for many years, like we said, HPV can be dormant in your body for a long time, for a number of years. So it might not have been picked up because it was lying dormant, but it can kind of come to life through we don't quite understand what can make it active again. So it's still important to go for your screening and your smear test, even if your last one was clear. I have always used condoms, so I am not at risk of catching HPV. So do you think that is true or false?
False.
False. I'll say false.
False. Yep, you're absolutely right. So condoms can provide some protection, but they don't fully protect you because it's the skin-to-skin contact that's how the HPV is transmitted. So it doesn't cover the whole genital area, so it doesn't provide 100% protection. I am postmenopausal, so if you're an older woman who's been through the menopause, but you're still within screening age, so you're offered screening up to the age of 60, up to the age of 65. So if you are postmenopausal, I don't need to go for a smear test.
False.
I'll say true, but I'm not sure.
So we didn't actually cover age range there, but that one is false because age doesn't particularly come into it. It's all to do with HPV. So HPV can be present in your body at any age, really. So being after the menopause doesn't make any difference because it's all to do with the HPV virus, the virus. So that one is also false. This one, HPV is really common and almost everyone will get it at some point in their lives.
True.
What marks do us, Heather?
Yes, true. You're doing really well. Yeah, that is true. It is very common. But most people haven't heard of it. So when people are starting to get these letters now saying whether or not they have HPV, we've had quite a lot of people phoning our helpline in a bit of a panic. And really worried, thinking, what is this? How have I got it? Is it, people are saying, is it an STI? Does it mean, that my partner's been unfaithful? There's all of these worries that people have, but actually it's a very common virus. And the last one, I've never had sex, so I don't need to go for a smear test.
False.
True.
So this is a tricky one. But we would say false. So the reason being, it depends how you kind of categorize sex, I suppose, because it doesn't need to be penetrative sex. HPV can be passed on through any type of sexual contact, is what we call it, like touching. So it can be through hands, anything else. So you don't need to have had sex to be at risk of HPV. If you have never had any type of sexual contact at all, then the risk of getting HPV is lower. It's a lot lower, but it's not zero. So it is a personal choice, but we wouldn't use that as a reason not to go for cervical screening. So so you both did very well there. that was a very good effort. How can cervical screening be prevented then? So we know that we want to eliminate cervical cancer in the UK, and we're quite lucky in Scotland because we've got a very effective HPV vaccination programme, and that runs in the schools, and we've got our cervical screening programme. So it's the combination of these two things, getting the HPV vaccine when you're at school, because that can protect you against some of the most high risk HPV strains, but not all of them. So that alone will not eradicate cervical cancer. The cervical screening programme is still important because it'll pick up the HPV types that the vaccine doesn't protect you against. So it's these two things. If we can get enough people to get both of these, we believe we can eliminate cervical cancer in the UK, and the World Health Organization, that is their goal as well, to eliminate cervical cancer. So the HPV vaccine, like I said, it's offered in schools to boys and girls. So it used to be just girls that were offered the HPV vaccine when it was first introduced, but it's now offered to boys because it can provide protection against some things that are useful for them as well. So it can protect against some head, neck, anal and genital cancers too. So it's not just cervical cancer actually. And it provides protection against genital warts. Plus obviously boys could pass HPV to girls and to other boys, and girls can pass it to girls. So boys and girls are offered it. It's part of the programme. So usually when you're in about first year, you should be offered it. There's a lot of evidence and a lot of research has gone into the HPV vaccine, and it shows that it's very safe and that it's very, very effective. It's given in just one dose as well. And like I said, it protects against the high risk HPVs. And then there's cervical screening as well. So just to describe what it's like to go for cervical screening, I've got another short film here that we made alongside the people from Enable. So I'm just going to show this. I've got a feeling that this one talks a little bit about COVID though. So we haven't been able to edit that out yet. So please just bear with that bit because it talks about wearing a mask and things. But thankfully we've moved on from that, so we don't need to worry about wearing masks while you're in the GP practice anymore.
Once you arrive at the practice, the receptionist will greet you. You'll take your name and ask you to have a seat. The nurse will come and get you and bring you back to their room. At this moment in time, during our coronavirus crisis, yes, face masks are worn by the nurse and yourself. The nurse will also have a plastic apron and gloves on as well. There's hand sanitizer available in all the practice rooms. All reception staff and GPs all wear masks when in the clinical rooms and in the reception area. We're very much encouraging women through this time to still come in and get their cervical smears. We're trying to reduce the risk of cervical cancer, so that it's a very important thing to keep coming for. Once you've arrived at the GP and the nurse takes you into the room, you will be asked to just sit in the chair and have a conversation with the nurse. Once you feel comfortable with having the smear test done, the nurse will show you behind the curtain to the bed, and you will then take off clothing that you feel comfortable to take off. Sometimes a skirt or loose joggers might be an ideal item of clothing to wear. Onto the bed you can take a blanket with you. There's usually the paper towel that we have that you can use and put across you then. Once on the couch, the nurse will ask you to go in a comfortable position which suits you. The speculum then is inserted into the vagina for the nurse to take your smear test. As long as you feel comfortable doing that, the nurse will carry on, and it only takes a few minutes with the brush round your cervix to get a few cells, and that's the test over and done with. This is the opening mechanism that opens the speculum up and takes the vaginal wall out of the road. The next part is using the brush, and the brush looks like this, and that just goes through here. And when you open the speculum up, we can see your cervix at the end. And that's it. A small amount of gel can be used as well. This is the one that I use here, the small amount of gel just on at the end of the speculum. You'll feel it just a wee bit cold, and that helps put the speculum into the vagina. The cells, once they get put into the pot of liquids, they get sent off to the lab, and results are returned to you by letter within about 4 weeks.
I'm Jackie and I'm from Glasgow. I'm 53 years old. This is the first time I ever had a smear test done before, and so it was fine. It was over and done with before you knew it, you were finished. And she was a friendly nurse. That's what you want. You want to go in with a nurse that can talk to you, make you feel relaxed, has got a nice smile on your face. You know she's wearing a face mask, and even if you're wearing one, she's still got a smile on her face. You could tell by looking at the eyes, she was quite happy. And I was quite happy, and that was me away home. If you're feeling scared, if you want a member of your family, do that, or take one of your friends and just so they're there with you, you're not going to feel scared.
Getting a cervical smear test sometimes can feel a bit uncomfortable, but it certainly shouldn't be painful. And at any stage of the test, if it's sore and you want the nurse to stop, you just please say to stop, or it could be a small tap on her leg, whatever, just to tell her to stop the procedure. And that can be agreed before you start the test. There are varying things that we can help you with. If you want a friend or a family member to come with you, then that's absolutely all right. Most practices, we have a variable bed which helps mobility, or there's different positions we can help you with as well. If you want to take one of the speculums home with you and try it in the own privacy of your own home, then that is fine too. There's lots of things that we can do that may help you feel better about it. If you want to keep on your underwear, then that's possible too, to have a smear done then. You can always request a double appointment if you feel you'd need a double appointment as well. There's no problem with that at all. You just have to call your GP practice and ask to speak to the nurse. And that could be a male or a female nurse. If you would prefer a female, then you should say that to the person you're booking the appointment with. And if you'd like more information, you can check out these websites for some support and advice.
There, so that video just went through a bit of a step-by-step of what's involved in cervical screening, because that's the second part of the cervical cancer prevention action that you can do. So it's a test that can help prevent cervical cancer, because like I showed in the earlier diagram, it takes so long for cervical cancer to develop. Cervical screening can actually pick cells up before they develop into cancer. So if there's any sort of change in them at all, if we would call that cell changes, sometimes it's referred to as abnormal cells, then they can be identified through cervical screening. You'd go off to colposcopy, which is the place in the hospital that you would go to, and they can be removed or they can be treated, and that's long before cervical cancer has even started. So it's a very effective programme to prevent cervical cancer. So all women and people with a cervix aged between 24 and a half, so you usually get the first invite just before your 25th birthday, and 64 years are invited to attend cervical screening. So it involves a speculum and a brush, like you saw in the film, and they are gently, they are used to gather cells from the cervix directly. And these cells are sent off to a lab to be tested for HPV. So if no HPV is found, so when they test them in the lab, then you don't need to go back for your next cervical screening for 5 years. So it's a very sensitive test now that they use in Scotland. It was changed in 2020, so just when the pandemic hit, they changed the way the programme works in Scotland. So now we've got a new, very sensitive way of checking for HPV, and because of that, it's actually a more effective way. So it's safe now to wait for 5 years if you have no HPV in your body. If HPV is found, though, the sample that they took when you went for your screening will be looked at under the microscope, and they'll see if there's any cell changes. So if there are cell changes, they'll send you an appointment to go to the hospital for colposcopy. So that's when they can just look at things a bit more closely and decide what to do. If there's no cell changes found, then they won't do anything, but they will invite you back to come possibly in the next year to go for another cervical screening. And the reason for that is because, like we were saying before, your immune system quite often clears HPV by itself, like it would do with other viruses. So they want to give your body time to potentially clear it without having any sort of treatment, or, you know, there would be no need if your body's going to get rid of it. So you would be invited back for screening in possibly about a year's time, and they would go through the process again of checking for HPV. If at any point during those extra checks cell changes are found, you would then go to the hospital. So cervical screening isn't a test for cervical cancer, or it shouldn't be used that way. So you would go for screening or a smear test if you have no symptoms. So if you're feeling healthy, you're feeling well, you'll get that invite through the post saying you're due to go for cervical screening, and you would just go. So it shouldn't really be thought of as a test for cervical cancer. So if you were worried about any symptoms or any changes in your body, it's really important that you go to your doctor about them, because they can be looked at separately, and it's completely different to the screening programme. So it's important to know what the symptoms are. So it's any bleeding, vaginal bleeding, that's unusual for you. So that can be between periods, after sex, after the menopause, anything that's out of the ordinary. It's just worth getting checked. Any changes to discharge that you would find in your pants, So it might change colour, smell, consistency. Unexplained pain in your lower back or pelvis. So lots of us get back pain. I quite often get back pain, but you know what's normal for you. If it's something that you've not had before, it just feels a bit different and it's prolonged. So it's not going away. You've had it maybe for a couple of weeks and you just don't quite understand it. You've not had a new, got a new bed or been sitting in a new chair at work or anything, then just worth getting it checked. And any pain or discomfort during sex. So it's important to stress, though, if you do have any of these symptoms, please don't panic and think, oh, it's cancer. Chances are that it won't be, but we should just never ignore these symptoms because nobody knows your body better than you do. So if you are concerned, just make an appointment with your GP. So I've mentioned a few times now that we've been working closely with Enable Scotland, and we've been really pleased to do that. Our work in Scotland is funded through the Scottish Government, and the reason and our funding enables us to work with women across the country who are known to be less likely to attend cervical screening. And one of those groups is women with a learning disability. It's really hard to get accurate figures about how many or what percentage of women with a learning disability actually attend cervical screening. But there was a study that showed about 3 out of 10, so about 30% of women, it was thought, with a learning disability attended a cervical screening. But this was before the COVID pandemic. So we believe this is probably even less now. Cervical screening uptake in Scotland is at the moment the lowest it has been since records began. So rates are declining and women with a learning disability are less likely to go than the general population. So we feel strongly about working with women to try and understand what the barriers are. So what's stopping you from going if you have a learning disability? And more importantly, how can we address that? So what can we do to help? So we've got we've did a lovely photo shoot, like you can see there, in Glasgow Green. We were so lucky with the weather that day. There was a big downpour about 10 minutes after we'd finished taking our photos. But the work that we've done so far, we've delivered awareness sessions to women. So we kind of similar to this, I suppose. And we've also run some focus groups. And what we've learned is that a lot of women say that they don't go or they would be unlikely to go because they feel really anxious about going. They might feel embarrassed and a lot of people feel scared. It's a kind of fear of the unknown. If you've not been before, you don't really quite understand what happens during the test. So that's one of the reasons that we made these films. Because we were told just, through working with Enable, the women were telling us that, having films to actually show the step-by-step process would help with some of these barriers, because if you understand what to expect before you go, then that can really help. And a lot of people say they don't understand what the test is for. So why would you bother going? What's the point of it? Is it relevant for me? And sadly, we've had quite a number of women tell us that they've been told that it's not necessary for them to have screening. So kind of anecdotally, people have been saying, oh, don't worry about it. It's okay. You don't have to go. So we feel strongly that women should have the information that they need and the support that they need to be able to decide for themselves if it's something that they want to do. So we have worked with Heather. So Heather, you can see, is in this picture here, and she was really brave recently and shared her story with the public. Yeah. So she shared it publicly. It was in the media, it was on our website, it was on social media, because she's got a really good story about her experience of working with Joe's Cervical Cancer Trust through Enable. She helped us make these films. So I've showed 2 of the films today. I think it was either 4 or 5. I can never remember. Was it 5? Yeah. We made 5 films in total. So I can send out the links to all of them afterwards. So she's helped us with that. We're currently making a new easy read guide. And again, Heather's involved in that group. We've got a group of women who have been amazing in helping us to create a new guide. So we hope that'll be ready in the next 2 months or so, I would say, and we'll be able to print it and share it widely across Scotland. So Heather's done lots with us. She's been in the focus groups. She's done the sessions. So I'm going to hand over to her to tell her experience. So will I stop sharing my screen just now, Lauren?
Yeah, go for it. Go for it.
Right, hold on, so we can see her. There.
Hi, so I'm gonna share my story here, so you can see it. There you go, anyone can see that. So I can see there's a lovely photo of me there. So I'm gonna read through that story. Hopefully you can get some information and some context on it. So Heather on cervical screening for women with learning disabilities. But I'm gonna have to move these. When I started to get elected to go for my cervical screening smear test, I had no attempt. I only realised that I should go when I went to a cervical cancer awareness session with Jules Chuck and Enable. The team from Jules explained what a smear test was for and what happens when you go for a test. They also answered my questions about going for a smear test and gave some tips about how to make it a little bit easier. I went for a smear test the first time, the year before last, when I was 30 years old. I was really, really anxious. I was nervous because it was the first time and I was a bit embarrassed. Smear test is a very personal thing. And in the end, the test didn't work because I was just too anxious and I couldn't get specimen. Last then said I had the option to get my smear test done at the hospital, but only if I really wanted to. So in the end, I didn't. I kept working with Jules, Chuck, and Enable, and I found the sessions they ran interesting. And I liked learning about how to protect myself from cervical cancer. I attended some more online awareness sessions and took part in a focus group to talk about my own experience of smear test and to share my opinion on how to make going for them easy. I then worked with Jules Enable in a film called Production Attic to make some new films for women who have a learning disability about cervical cancers and going for smear tests. After learning so much, I was determined to have a smear test done. So I tried to do it. And when I went for the second time, it was so much easier. I knew what to expect for the first time. And because of the work with Jules, I wasn't in pain like I was the first time. And also knew from my work with Jules that I able to bring someone along. So I brought my mum with me. During the appointment, the doctor said they thought I could see something unusual, so it was important that I went. But unfortunately, I got my results back and they were normal. I was relieved. My advice is don't be anxious, go for your smear test. It's over really fast and the nurses are really nice and make you feel comfortable. And also, a wee bit that's not in this, the doctor actually said I was the best patient ever. So, yeah.
Okay.
So if you have any if you're anxious or have any questions, we are here to support you. You can contact the Jules helpline or go on 0808 822 800 or use our expert service here. There we go. So I'm going to stop sharing.
Thank you, Heather.
Thanks, Heather. You did so well. Yeah, like to share that story is not an easy thing because, like you say, it's quite a personal thing. So we appreciate you sharing that because that'll help so many people. And the fact that you went the first time and it didn't work, and you felt, because I remember at the time you said you felt a bit disappointed that it, that you hadn't been able to go through with it, but then you went back a second time, and that's not an easy thing to do. And then they said you were the best patient, so that's
the doctor said I was the best patient. And I was cool for that.
Oh,
So that's a brilliant, brilliant achievement, and we just hope that that's what we want to see happening more. So hopefully, by hearing your story, other people will feel that they might be able to do that too. So
Yeah,
thank you for doing that.
Because that was shared during Cervical Cancer Awareness Week.
That's right. Yeah.
So I was approached by Iona and another fellow who works in Joseph called Therese. And Therese helped me write the story. So, yeah.
good.
So,
Well done, you.
Yeah. So I've just got one or two more things to do, and then I'll be finished as well. So I'm nearly at the end now. So Heather, if you've got anything more to say, we can also talk about that too. Yeah, we can see how it goes. So where have I got to?
Yeah.
Oh yes, here we go. Yeah, so about the barriers that women have. Yeah, and something that came through quite a few times is that how important it is to have a good relationship with the nurse. So that's yes, sorry, this is not the slide that I expected actually, but that's fine. So like Heather said, and like we've said, we've made the films for women with a learning disability to try and tackle some of these barriers that we've learned. So you saw Jackie on the film there. So she also shared her story and her experience of going for screening for the first time, because she also went for the first time after starting to work with us. And the films, we've done a bit of research after they were made to find out how effective they are. So we got an external company in to evaluate them. And what and it was with women with a learning disability. And the feedback we've had is that they find the information good and was simple to understand. And some women have said it makes them feel that they need to go and get it, or at least speak to the GP. So we know that these films are effective. So like I said, I will share the links to them. So if any of the women that you care for, you think they would be interested in them, then they're readily available. They can click and learn about HPV, learn about screening, they even go through what the letter means, because we had quite a long conversation about the invite letter for going for cervical screening, and that it's quite confusing. So you don't get an easy read version as standard, you have to request it. And that's quite a difficult process, because one of the ladies was saying that she had to get her mum to phone, and that she phoned this number and then she was given another number to phone, and then it was engaged and she had to phone back, and it really wasn't an easy thing to get a hold of. So when you look at the letter, there's quite a few numbers. There's like a CAI number, a phone number, a date, an address. So we've got a video that helps kind of explain a bit about what the letter means and what you can do and how to understand it. So yeah, we're very pleased with these films, and we are working on a new easy read, like I said, that should be available soon.
Yeah, we're working on it at the moment. We've just finished going through it and making the changes, so hopefully I'll be ready for it.
Yeah, it shouldn't be too long, because we had a group of us, I think there must have been about 10 of us in the working group, wasn't there, Heather? Yeah, and we spent 3 full sessions. I think there was about an hour and a half in each one, going through bit by bit, what we want to see, and we got some amazing feedback, like I said. So because we've got an existing easy read guide at Joe's, but it's out of date, so we're going to totally revamp it based on the feedback that we've had. So we will share that as soon as it's ready. So some of the tips that have come out of the work that we've already done, how to make it easier. And a lot of this is through feedback from women with a learning disability, and what they've said will help. So these are some things to try. So ask for a longer appointment when booking. So you don't, and just to know that you don't need to go through with the test on the first visit. So if someone is feeling very anxious, if they're just a bit scared, they don't quite know what to expect, they feel it might be too much, you can just go along and have a chat. You can meet the nurse, you can see the room, see what it is, understand that there's a curtain that you're behind, so it's private. You can do that, and if the nurse understands that it's your first time, or even if you've not been for a long time, that you are feeling really nervous, if you do have a learning disability, they are usually very, very accommodating and understanding, and they will try their best to support you. and you can bring someone with you. So Heather, you said you brought your mum.
Yeah.
So yeah, that can really help. Just having someone, whether it's someone in your family, a friend, just somebody that you trust, a carer, you can bring someone with you, and they can either stay outside, so they don't need to come into the room with you, or they can go into the room with you, hold your hand,
Yeah, 'cause
whatever's helpful.
my mum came into the appointment, both times actually. She came the first time as well, and the second time, so
Yeah,
make
and
sure you say to your carer, whoever you support, then they can bring someone along with you. And I think I'm more than happy to have your parent or carer or whoever in the room with you.
yeah, and it can just make you feel a little bit more comfortable if you've got a friendly face there. And also tell the nurse how you feel. So make sure that they know if you're just a bit nervous or anxious. And wear comfortable clothing. So if you wear a skirt or a dress, then the handy thing about that is that you can just pull it up, so you don't actually have to, like with trousers, you would need to take them off. So it's just like one less layer that you have to remove. You can listen to music during the test. I've heard a few people say that that's helpful. So they just have headphones in. So you can say to the nurse, look, I'm just going to put my headphones in, and they'll be fine with that. And if it's just something to distract you, and it can just help quite a lot of people to get through it a bit easier. You can ask if you can keep your pants on. So sometimes that's possible. It might not always be possible, but you can always ask the question. And again, then that would be one less layer to take off. And you can request a female member of staff, whether that's a nurse or GP, or if you've just got a trusted member of staff. So if you've been going for a long time to the same GP practice and you know the nurse or you know the doctor and you trust them, you can ask if they could do your smear test or your screening for you. And you can ask to see the equipment they use first. So you saw in the films there that they've got the speculum and the brush. So you can actually go in and see them, hold them if you want, to see if that helps. And you can ask to lie in a different position. So normally you would go in and you'd be asked to lie on your back on the bed, but that's not always the most comfortable position for everyone. So if for any reason that's not suitable for you, or the person in your care, you can ask to lie in a different position. It is possible to do this test in other positions, so you've just to ask. And if you are going through, or anybody you know is going through the menopause or they're post-menopause, that can add additional challenges at times. It can be a bit slightly more uncomfortable to have the test done. But if that is the case, you can be prescribed creams or pessaries that can make it more comfortable to get your screening done. Because if it's too dry, then it can just be a bit painful getting the speculum in. But if you have these creams or pessaries, that can help with that, so it's much more comfortable. But not everybody knows that you can request these things. So they're just some of the tips to make it easier. So I had planned to have a discussion now about what support and information is available for carers to help people in their care attend cervical screening. But I think we will maybe just skip this, unless you've got any thoughts about this, Lauren, or Heather.
No, I just think it's super interesting, Iona. I have always gone for my smear. I've always gone, but there are so many things that I've learned, and I think I obviously kind of missed out on. I'm older than some of my younger friends have had the vaccine, and I think they know more about it. But I think so, because the vaccine sort of came in later than sort of when I was going through school and things. It's not something that was kind of talked about, or it was just, I remember getting a letter and thinking, oh, I better go for that. But I didn't really, it was really interesting you saying that it's not actually a test for cervical cancer.
Yeah.
I had never actually thought about it that way. So yeah, I think even for me, as somebody that's always gone for my smear test, it's just really interesting. And I've learned something. So yeah.
Oh, good. I'm pleased. Yeah.
And that's why I'm through my work with Joe, that there is more information out there, and there's more. It's made me a lot less anxious to go for smear tests now, because obviously before my working with Joe's Trust and like I said in the story that you heard there, I know the lesson for years. It wasn't really until I had picked up the lesson and started to acknowledge them. Probably wasn't until I worked with Joe's Trust, and then I started to acknowledge the records.
Mm-hmm.
And I thought, oh, I better go. But so I got massive thank you to Joe's Trust for helping
Yeah.
me, because if I hadn't worked for Joe's Trust, I probably would have gone for the smear test. I probably would still be annoyed the records, but do I feel there's enough information available for kids? I would say yes and no, because I feel sometimes there is enough information, or sometimes, because
I think it's,
sometimes you feel you have to, the only way of kids getting enough information is if they go through a charity of support, like for example, Enable, Joe's Trust. Then they'll have that information, because
Mhm.
it's not widely given within the energy unless you get the letter, of course. But
I
if you
think
get
I
one,
think it's
yeah,
getting better. I think compared to when I was, I mean, I'm talking as if I'm an old lady here, and I'm really not, but compared to when I was younger, you know, and maybe sort of getting my first smear test, I think there is more information. I think there's maybe a way
Yeah.
to go, but I think there is more. I think it is more, you know, it was something that was quite a kind of taboo subject that
Mhm.
you know, I'd heard these horror stories, you know, about going for your smear test. And I remember going the first time and thinking it was absolutely fine. You know, it's
Yeah.
naturally not something you would choose to do every, you know, every
Of
week.
course.
But I just remember thinking, gosh, what was all the hoo-ha about? But I think
Mhm.
I think information is becoming more available. There's probably a way to go, as I said, and particularly for people with additional needs or disabilities. But I think it is getting better. Because as I say, compared to sort of when I was younger, it's certainly, you know, it's not this sort of embarrassing thing that people don't want to talk about as much anymore, I don't think.
Yeah.
I
Yeah, I
know.
would agree. I
But
think, sorry, Heather.
I said, what could, in fact, not what could help. I don't feel it's pushing the work for charities to work with Joe's Trust. But for example, I know Blair and Able are working with Joe's Trust, and maybe it's getting the word out there, and whether it's through the Cervical Cancer Awareness Week, or whether it's through that the films that we did with Production Attic,
Yeah.
or even just doing TV stuff, or getting
Yeah.
information out for carers that way, or
Maybe just
yeah,
raising awareness of what's already there.
Mm-hmm.
yeah,
Yeah, because
exactly.
I think I kind of agree with what you're saying, because it feels like there is information there if you know about it,
Yes.
but it's
Yeah.
you might not necessarily know where to look if
Yeah,
you
that's
know, if
why
you were
it's just
interested.
getting it out there. It's
Yes.
just
Yeah.
using the resources that you already have and just pushing it
Sharing them.
out
Promoting them
there.
Yeah,
more
yeah.
widely.
It's something
Okay.
I thought about as we were watching that and going through it, was actually that's the first time I've seen the little speculum and the and actually what happens. I feel like
Yeah.
it's something I've gone along to and had
Yeah,
this
of
thing
course. You don't have
happen
a
to
view.
you, and you don't, you know, you don't really know. It's just something that happens, and you
You
get a letter.
can't see what's going on, of
So,
course.
so yes, that was something that I was thinking was quite interesting. Is actually that's, you know, so I guess that is quite daunting for people, and not kind of knowing what to expect, and then even when you're there, still not really knowing what's happening. It probably can be really daunting for people. But no,
Yeah.
I think Heather's right that these resources are brilliant, not just for women with learning disabilities or other disabilities, but for everyone, you know, because
Yeah.
it's you know,
Do you know
It's
these
brilliant.
films were originally hosted on NHS Inform?
Yeah,
They chose to host, I can't remember which ones, and they said that they were getting they were really popular with lots of like people, like just the general population, because they were created with, you know, Enable for that audience, but they were so useful because they just explain things in quite a straightforward way.
Yes, definitely.
And yeah, and it's quite a complicated topic when you start talking about HPV and people haven't heard of it, and
Yeah.
it can be quite confusing. So these films just explain it in quite a simple way. Okay, thank you for that, for sharing your thoughts. We do have more work to do, obviously, but it's good to know that what we've done so far is useful.
Yeah.
We maybe just need to spread that, to share them a bit further. So just to finish then quickly, if you do want to find out any more, or if you're thinking yourself or for anybody in your care or anyone you support that you would like more information, then we do have some services that you can use, and they're all free. So we have an online forum, so anybody can access this. It's like a chat room type idea where you can chat to others, you can ask questions, and that can be about anything. There's lots of different topics on there. It's really well used, our forum, actually. It's, you know, I think there's hundreds possibly of posts each week, so have a look on there if you're interested. We've got an Ask the Expert service, so this is when you can send us an email. So there's an email address on our website. You can write an email and with any questions to do with HPV, to do with cervical cancer or screening or whatever it might be, or colposcopy, anything at all. And it can be about you, you know, it can be anything, and we will ask an expert on your behalf. So we've got a panel of experts who work with us. So it could be consultants, nurses, you know, in whatever field. So we can get an answer for you. Obviously, they won't know your own personal history, so they can't tailor it precisely to you because they wouldn't have all the records, but they will be able to answer as best they can the question based on what the information they have. And we have a helpline as well, so anybody can call that, and we've got trained staff and volunteers who can have a conversation with you. And that's even if you're worried, you know, if you're just got some concerns, you don't understand something, they are happy to chat with you. You can also go to our website, Your Own GP or NHS Inform. So that was everything I was going to go through today. Oh, there, sorry. So that was also, unless you have any questions, there was nothing.
No, what I'll do, thank you so much, Iona. As I said, I feel as if I've learned things myself, and it's, you know, it's something I've always done. So I'm really, really pleased that, as I said, it was meant to be more of a discussion, but it's ended up being a kind of recorded session. But I didn't want people to lose out, and I'm so glad that we've done it, because I will send this out to everybody. And Iona, if you have any wee links or anything like that, if you send them across to me, I'll make sure that those go out to all of our members as well.
I'll do that.
And if we have any questions, you know, Iona, I'm sure you'll be happy to
please send them on, or any ideas or any concerns or just any thoughts, I think, because from carers, that's an audience that we haven't engaged much with our work. So we've recently we've been working with NHS Highland, actually. They're working on an online module, and staff and carers are part of the audience for that. So it's not finished yet, but we are inputting into it. But other than that, we haven't done much with carers. So I'd be really interested to, you know, to hear views on how we can, you know, what conversation should we be having about cervical screening?
No, I will. If we get any questions or feedback or anything like that, I will put you in touch. And equally, if there's anything that our Family Connect group can help you with, so if there was, you know, if you were looking for people to get involved or anything like that, then please let us know, because they're
okay, that's really good to know.
They're a great bunch of people. And as I say, I'm sorry if anyone missed out this evening, but hopefully we can get the recorded session out and everybody can still sort of hear this. We know that not everybody can get with us on a Thursday evening at this time. Parents and carers are the busiest people ever, so
I totally appreciate that.
It's always really useful if we can record the session, because then people can watch it in their own time. So But thank you both so much. It's been lovely to see you. Thank you for joining me and giving up your time. Just for anybody that's watching, this month has been all about health. Hence why Iona has been here this evening talking about this really important topic. Next month is education. So please keep your eyes peeled for information and resources, and we'll be sharing things throughout August all about education. So thank you, ladies, so much. And thank you to everyone that's watched. All right, thanks very much. Take care.
Thank you for having us. Right, bye.